Hello, welcome back. And in this video lecture, we're going to pick up where we left off about coding skin ulcers, otherwise known as pressure ulcers. And again, very important to pay attention to these chapter-specific guidelines for chapter 12. And with the skin ulcers, we're only going to assign the appropriate code for the pressure-induced deep tissue damage. We covered the healed versus healing, the non-pressure ulcers. And again, specific guidelines on this, assign these codes using the appropriate code for unspecified severity if needed. And if a patient is admitted to an inpatient hospital with a non-pressure ulcer at one severity level and it progresses to a higher severity level, we would use those two different codes, one upon admission and the second higher code reported during the admission. Now we're going to pivot away from our discussion of pressure ulcers and we're going to talk about cutaneous abscesses and cellulitis. And again, it may be worth your while to look at some diagrams about the different layers of the skin so this makes a little bit more sense. Cellulitis is an acute inflammation of a localized area of the subcutaneous tissue. Some things that predispose people to having cellulitis include such things as open wounds, ulcerations, dermatitis, athlete's foot infections, and so on. And this is where you get the red hot skin with the edema at the site of the infection. The cutaneous abscesses, the cellulitis, lymphanginitis, the L2 through L3. This is a collection of purulent material, otherwise known as pus, that shows up in a localized infection. Could be an acute infection, could be a chronic infection, and so on. A lot of times we see these as a result of laceration or other skin trauma. Typically, we do the irrigation and drainage types of things, the incision drainage procedures that you see sometimes described. With acute lymphangitis, codes falling into the L3 category, this is an inflammation of the lymphatic vessels that are located under the skin. Strep is usually the common culprit. This is caused by some sort of laceration within the skin. A related term is the lymphadenitis, right? The inflammation of the lymph nodes that you get with this. Dermatitis and eczema, of course, we use these terms interchangeably. And again, the diagnosis is made based on the appearance of the skin and thorough medical history. How we treat it depends on how bad it is. And then, of course, we have all different types of dermatitis, as mentioned here, L20 through L30. Allergic, diaper dermatitis, atopic dermatitis, and so on. We could talk about all these different subterms, but the main point to remember is that we have to read the documentation carefully, especially once we hit the main term of dermatitis. And the last slide we have the urticaria and the erythema, L49 through L54. These are the vascular reactions in the upper layers of the skin, typically called hives, hypersensitivity, allergies, what have you, sometimes insect bites. And the erythema is the redness of the skin due to the congestion of the capillaries. This could also be due to a drug allergy or drug sensitivity. Sometimes this is described as a self-limiting condition. In other words, it goes away by itself no matter what you do, type of thing. And we also have some other things. And again, how we could code some of these pretty straightforward, in my opinion. Stevens-Johnson syndrome, start with syndrome, Stevens-Johnson, it's right there. Or since it's an eponym, you could go right to Stevens-Johnson, get the code that way. We can also have necrolysis, these types of skin dying, right, may occur with SJS. Again, if it's due to a adverse effect of a medication, we would code that. Any other associated manifestations also code that. If you've ever known somebody who's had external beam radiation therapy, this is very common. Radiation-related disorders falling into code categories L55 through L59, right? We can also get these things from sunburn, right? It's not classified as a burn, as Chapter 19 adverse effect. We can get acute skin conditions due to ultraviolet light, non-ionizing radiation, these kind of spots, the actinic keratosis that we sometimes see in older adults with a lot of exposure to the sun. These can be considered precancerous, lead to squamous cell carcinoma. And of course, we can have disorders of the skin appendages, meaning the nails and the hair, alopecia, hair loss, right? Some of these other things. Again, we kind of dived into this a little bit, but the decubitus ulcers, pressure ulcers, L89 codes, these will identify the site, the laterality, and the stage. We want to make sure that we code first any associated gangrene. The fourth character, meaning right after the 9 in this case, would describe the anatomic site. Fifth character would describe the laterality. And the sixth character is the stage. And of course, we base this on what the physician actually does. We've been doing a lot of training efforts since elder adults come in with these things frequently. Stage 1 is intact skin with the reddening. Stage 2 is partial thickness skin loss with exposed dermis. Stage 3 is the full thickness skin loss, where we're seeing the adipose tissue visible and granulation is occurring. And then stage 4 is full thickness skin loss with tissue loss, and we have exposed fascia, muscle, tendon, cartilage, or even bone. One thing that people get confused on is if it's an unspecified stage or if it's an unstageable ulcer. Unstageable means that we could stage it, except it's obscured. Could be obscured by dressing, could be obscured by slough, what have you. The deep tissue pressure injury is a persistent, non-blanchable discoloration where we sometimes get a red bed blister. And again, we used to code these as unstageable. That's no longer correct. Now we have the non-pressure ulcers of the lower limbs going from L98 to L97. And again, like the pressure ulcers, we want to make sure that we code any associated gangrene, atherosclerosis, chronic venous hypertension, diabetic ulcers, prosplendic syndromes, post-thrombotic syndromes, and varicose ulcers. Okay. Note that these are ulcers, much like the same way we had before, but if you think about the other causes of it, makes sense to give them their own category. And of course, we have different subcategories, as you'd see right here. The L98, so this is a pressure ulcer of the buttock, right? So L98.411, limited breakdown of skin. L98.412, fat layer exposed. L98.413, necrosis of muscle. L98.414, necrosis of bone, muscle involvement, and so on. So important to read the documentation very, very carefully so we get the correct code. And that's all I have for you. Thank you for watching and reach out if you have any questions about any of this material. Bye now.